Knuckle cracking sounds alarming, but the truth is far less dramatic than that. Most people hear the pop and imagine cartilage grinding like gravel underneath painfully. In reality, the sound usually comes from tiny gas bubbles forming inside joints. Those bubbles form in synovial fluid, the slippery lubricant inside your joints quietly. When you pull, the pressure drops, and dissolved gases rush apart suddenly fast. That rapid separation creates a bubble burst, not a bone fracture at all. So the noise is real, but the damage usually is not there either. Your knuckles are built for motion, with joints that move constantly all day. They contain cartilage, ligaments, and fluid, designed to reduce friction during natural motion. That design is why normal cracking rarely harms healthy joints much over time. When the joint releases, the capsule momentarily expands and resets itself again. For a second, the space inside changes pressure faster than fluid can adjust. That sudden pressure shift is what helps create the popping sound you hear. It can be loud because tiny structures amplify the release in joints enormously. Loud does not mean dangerous. Volume and harm are not twins here. Still, repeated forceful pulling can irritate soft tissues around the joint capsule itself. That irritation may leave fingers feeling sore, puffy, or temporarily stiff afterward. But soreness from overdoing it is different from actual arthritis damage by comparison. Arthritis is inflammation and degeneration, not a harmless bubble burst event here. The myth confuses a sound with a disease process in your mind completely. If cracking caused arthritis, surgeons, athletes, and teens would all suffer constantly too. But large studies have not shown simple cracking causes arthritis at all consistently. People notice the pop, then remember older warnings from childhood stories later vividly. A teacher, parent, or grandparent may have repeated it confidently many times before. Confident repetition can sound like evidence, even when it is wrong to us. Before scientific imaging, the body remained mysterious, and myths filled gaps. People wanted a simple cause for stiff hands, soreness, and aging joints. Knuckle cracking became a convenient villain because it was audible and memorable. A squeaky habit feels dramatic, so people linked it to damage instantly. Soon the story spread from household advice into everyday culture for decades. Once a myth repeats enough, it starts feeling medically true to everyone. But truth needs evidence, not just familiarity or fear in medicine today. That is why this myth persisted, even while science quietly disagreed repeatedly. Your knuckles are not fragile glass, they are engineered to move freely. Cracking them may be noisy, but noise is not diagnosis at all. The myth survives because it feels intuitive, not because it is true. In the next section, we will separate harmless motion from real inflammation. You will see exactly why the pop can happen without arthritis ever. And you will learn how that misunderstanding became a worldwide warning myth. Let's begin with the sound, the fear, and the science underneath it. Inside every knuckle, two bone ends meet inside a tiny joint capsule. White bones do not rub directly. Cartilage and fluid separate them completely. That cushion matters because smooth motion depends on low-friction surfaces each day. Synovial fluid coats the joint, acting like a slippery shock absorber in motion. It's chalky cayenne in our visuals, signaling lubrication and healthy spacing for movement. When you bend a finger, the capsule stretches slightly around the bones. That stretch changes pressure inside the joint, especially during sudden pulling motions downward. Dissolved gases normally stay mixed inside the fluid under pressure there, quietly. Carbon dioxide and nitrogen are the main gases involved in cracking. Pulling the finger quickly lowers pressure, letting gases come out fast. They gather into a bubble, forming a tiny pocket inside the fluid. That pocket expands until the joint reaches a critical threshold point steadily. Then the bubble collapses or bursts, producing the familiar pop sound. The pop is a mechanical event, not bone-on-bone grinding at all. Afterward, the joint often cannot crack again immediately for a while. Pressure must rebuild before another bubble can form and burst again. That delay is why repeated cracking feels less effective at once. Bone-white structures stay aligned, while soft tissues absorb motion safely. Cartilage protects the ends of bones from repeated daily stress nicely. Ligaments, shown in soft coral, stabilize the joint without locking it. Healthy joints move a little in many directions without pain or friction. The capsule contains the fluid, bones, cartilage, and supporting tissues inside. Everything works together to keep fingers flexible and resilient through use. Cracking simply changes internal pressure long enough to release gas safely. It does not scrape away cartilage or break down bone over time. That is why a pop can be loud but harmless in practice. However, forceful tugging can irritate surrounding tissues temporarily and sharply. Muted purple soreness may appear if you overpull the joint today. Even then, irritation is not the same as arthritis in joints. Arthritis involves inflammation, structural damage, and chronic pain patterns over time. Cracking alone does not create that disease process in healthy hands. Scientists have examined frequent crackers and compared them with others closely. Those comparisons generally do not show higher arthritis rates from cracking. So the joint anatomy explains both the sound and the myth clearly. Healthy anatomy produces motion, pressure changes, and occasional bubble bursts naturally. The body is not failing when a knuckle pops loudly in life. It's simply physics inside a small, well-lubricated joint for healthy motion daily. Next, we will see how habits and repetition keep the myth alive. And we will compare harmless popping with true signs of inflammation later. By then, the difference between sound and damage will be obvious. To test the myth personally, Dr. Donald Unger chose an unusual experiment. He cracked the fingers of one left hand every day for decades. The other hand stayed untouched, becoming his built-in comparison for evidence later. He expected soreness, swelling, or arthritis to appear in that hand eventually. Instead, the cracked hand remained surprisingly normal throughout the long test period. Year after year, he recorded each crack and kept checking carefully himself. No bright crimson inflammation emerged, and no arthritic changes showed up either. That long observation mattered because arthritis usually leaves measurable signs behind later. If cracking caused damage, the evidence should have shown it clearly somewhere. But his experiment gave the myth a quiet, stubborn contradiction instead there. Of course, one person is not perfect science, so researchers looked wider. They studied frequent knuckle crackers against non-crackers in larger groups carefully too. Those studies generally found no meaningful increase in arthritis from cracking alone. Researchers also examined finger function, pain, and joint health over time closely. The pattern stayed consistent. Cracking sounded dramatic, but damage did not follow. In medical terms, arthritis is not caused by harmless joint pressure changes. It involves inflammation, wear, immune activity, or structural degeneration in affected joints. That process is different from a bubble popping inside synovial fluid itself. Unger's hand became famous because it turned a rumor into a test, and the test kept saying the same thing. The myth was wrong. That matters because medicine needs repeated evidence, not just frightening anecdotes alone. Anecdotes spread easily, especially when they match what people already fear deeply. The problem is that fear is persuasive, even when biology disagrees quietly. So the Unger experiment became a memorable teaching tool for clinicians everywhere. It demonstrates how personal experiments can challenge a cultural certainty directly. Yet it also shows why bigger studies matter for confidence later overall. One hand is interesting. Many hands give stronger scientific reassurance instead here. Together, The experiments weaken the old warning without creating new fear either. Cracking may be annoying, but annoyance is not the same as disease. The evidence points away from arthritis and toward a harmless pressure release. That is why modern doctors usually do not blame knuckle cracking alone. They look instead for pain, swelling, stiffness, and lasting functional loss signs. Those are the signals that actually deserve attention and medical evaluation today. So the Crimson X belongs on the myth, not on every crack. Unger's story is memorable because it mixes curiosity, discipline, and patience beautifully. He tracked one habit for 60 years, then shared the result honestly. That honesty helped separate a loud sensation from real joint pathology clearly. In the next section, we will examine who should actually worry most. You will see when cracking is ordinary and when it deserves caution. For now, remember the X, not arthritis, just a myth defeated today. Arthritis is not the main risk here, but overpulling can still irritate tissues today. That irritation usually affects ligaments, tendons, and the joint capsule around fingers slightly. Those structures help stabilize motion, so strain can make them feel temporarily sore clearly. Soft coral ligaments may stretch beyond comfort when cracking is done aggressively carefully. Muted purple swelling can appear afterward, especially if the joint is pulled repeatedly afterward. That swelling is usually short-lived, not the same as chronic arthritis damage usually. Think of it as a local reaction to force, not disease progression instead. Grip strength concerns have also been studied because people fear weaker hands too. Some studies suggest frequent cracklers may report less grip strength over time sometimes. Others find no clear difference, so the evidence is mixed and limited still. That uncertainty matters because hand habits often overlap with age and lifestyle daily. Aging, injury, and repetitive work can affect grip more than cracking alone. So scientists separate correlation from causation before blaming the knuckle sound there. A noisy habit may travel with other behaviors without causing the outcome easily. For example, someone who cracks may also type, lift, or strain hands also. Those extra factors can confuse results if researchers do not control them well. Temporary swelling often comes from pulling too hard, not from the pop itself instead. When you tug forcefully, soft tissues can become mildly inflamed and irritated briefly. That irritation may reduce comfort for a while, especially after repeated attempts afterward. Still, it is usually reversible once the tissue calms down again. Soft coral ligaments support the joint, but they dislike unnecessary stress overall. Muting that stress means using gentler movement, not stronger force, to crack gently. If a joint feels tender, swollen, or unstable, stop and rest it promptly. Persistent pain is a different story and deserves medical attention promptly often. Cracking should never be used to test how hard a joint can take there. The body signals strain through soreness, puffiness, and reduced motion afterward. Those signs are mechanical warnings, not proof of arthritis developing inside. Grip strength can also drop briefly when pain makes you avoid force sometimes. That protective behavior is normal because your hand is guarding itself instead. So a weaker-feeling hand does not automatically mean permanent weakness always. Evidence points to caution with force, not fear of every crack usually. Most of the concern belongs to overuse, not the popping sound alone. The pop itself remains a pressure event inside lubricated joint fluid clearly. The tugging, however, can stress tissue if done hard and often. That is where discomfort, swelling, or tenderness may actually come from. Healthy joints prefer movement that is gentle, controlled, and repeatable. Respecting tissue limits keeps the capsule, ligaments, and tendons happier. In the next section, we will separate myth from real warning signs. Remember, arthritis is not the villain here, excessive force may be. Listen for pain, swelling, or instability because those matter most. After all the science, one truth remains: cracking often feels deeply relieving, honestly. That feeling matters because your brain loves the sensation of sudden release today. Tension builds in small joints, and a pop can feel like opening a valve. Pressure shifts, movement changes, and your hand briefly feels looser than before, noticeably. That looseness is real perception, even when no lasting structural change occurs afterward. Sometimes the relief is partly mechanical, partly psychological, and partly learned habit, too. Your brain remembers the pop as a successful reset, then expects comfort later. That expectation can create a placebo-like effect, making the crack feel satisfying quickly. Not because bones were fixed, but because tension and anticipation both eased nearby. People often crack when hands feel stiff after typing, gripping, or stress daily. The pop becomes linked with pause, motion, and a tiny moment of control. For many, it is a ritual that interrupts discomfort beautifully for a moment. Still, ritual does not equal repair, and relief does not mean injury here. A joint can feel calmer after the release without being healed differently afterward. That distinction is the heart of this myth-busting lesson today for everyone. Cracking knuckles does not summon arthritis, even when the sound feels dramatic. It is mainly a pressure event inside fluid-filled joint anatomy and spaces. If you pull gently, many joints pop harmlessly and return to normal. If you pull too hard, the warning is strain, not arthritis, usually. Listen for the body's real signals: pain, swelling, stiffness, or instability clearly. Those are the clues that deserve attention from a clinician right away. The myth taught fear, but evidence teaches confidence and precision instead, finally still. You do not need to panic every time a knuckle pops loudly. You do need to respect discomfort, force, and repeated irritation today gently. Healthy hands are resilient, but they still appreciate careful treatment daily, always. Move them often, stretch them lightly, and avoid aggressive tugging entirely here. Let the joint work naturally instead of forcing it to prove anything. A calm hand is usually a well-used hand, not a broken one. So the next time you hear that pop, remember the basic physics. Remember the bubble, the fluid, and the temporary pressure change inside now. Remember Dr. Unger's long experiment and the studies that followed afterward overall. Remember the crimson X over the myth, not over your hand today. Cracking may be a quirky habit, but it is not arthritis today. Relief can be real without damage being real in your joint sometimes. That is why the sound survives. It is satisfying, memorable, and harmless. Use the sound as a cue to relax, not to worry instead. Your joints are built for motion, not for fear or superstition daily. And that is the most empowering fact in this whole conversation, absolutely. Your knuckles can pop, your hands can feel relief, and your joints stay healthy. Keep that calm in mind. Sound is not damage, and relief is not disease.